today I'm going to kind of talk you through the process of using the Accupap, which is the PAP device that my clinical site uses. It's similar to an Easy PAP, except for you don't have to use a pressure gauge because you actually can set that pressure between the 10 and 20 on the device. Now, I do have to apologize in advance because of the price of these devices. I'm not allowed to take it out of the packaging, so bear with me if you can, and I'll just kind of try to talk my way through it. So, of course, anytime these therapies are needed for the positive airway therapy, it's to help with lung expansion, and you usually have a physician's order for that. You always have a physician's order for that, and you also are going to do that full assessment, which includes vital signs, breath sounds. You're also going to check the SpO2 and etc. So this is the Accupap that they use here at my clinical site. So to use this device, you hook this up to the flow meter using this tubing, and you set the flow meter at 10, and then you don't need the pressure gauge because you're actually going to set your pressure, so you can set it between 5 and, you can't really see, 5 and 20, so you just dial that in. So you can dial it between the 10 and 20 that you need, and then your patient is just going to tightly seal their mouth around the mouthpiece, and they're going to breathe normally. So it's a little different than the Easy PAP because they don't need the slow exhale or whatever because they already have the pressure set. So this device is used to help prevent atelectasis, as well as to help prevent air trapping with COPD or asthma patients. And you can also use this device with a bronchodilator so that it can help optimize the performance of that bronchodilator. So if you were to do that, you would remove the mouthpiece, and then you would insert some corrugated tubing along with the nebulizer cup and the setup, and then the mouthpiece at the opposite end. So it's just going to kind of like elongate the system, but you can use it along with this device as well. So after you've finished the treatment, you're going to have your patient cough, and then what you're going to do is do a reassessment. Listening to breath sounds, listening is important for that, as well as doing the vital signs and the SpO2 and looking at your patient's general appearance. So anytime your patient is in distress while you're doing any type of lung volume expansion therapy, you're going to use the triple S. You're going to stop what you're doing, you're going to stay with that patient, and you're going to stabilize them. So that would be how you would use this type of PAP device.